Are expensive products better than the affordable product?
The hype of snail mucin, like, it was such a hype, even I called for a bottle. It is just lying down in my wardrobe now. No company will tell you this, that you should never apply vitamin C on a skin that does not have great skin barrier.
How often should I wash my face?
Twice a day is good enough.
Collagen tablets. ये लेना चाहिए कि नहीं लेना चाहिए?
So collagen tablets is a huge scam. There are a lot of influencers who are trying a lot of products on their face and they land up in situations where the product is not suiting them. If a pregnant lady is even handling the strip of retinol, will have to go for an abortion. Please go and ask the doctor for the degree or the qualification before you sign up for any skin concerns with the doctor.
I'm warning you that this podcast may cause some glowing skin and some relationship goals. From acne to anti-aging and from love to laughter, we've covered it all. I, Karan Ahuja, co-founder at Skin Aesthete, am very excited to bring to you my better half and a very accomplished doctor, Dr. Sonal Ahuja.
Hi, I'm very excited for this one, and especially because I'm sharing today a seat with my dearest husband, a very hardworking man. And yes, we are partners in life and also partners in business now.
So Sonal, tell me about Skin Aesthete and the vision behind it.
So the dream of Skin Aesthete started when I did my fellowship in London in 2018. And since then, it's been a dream to make a center of aesthetic and advanced dermatology with best of the medicine, best of the equipments around the globe at one center, accessible to Navi Mumbai people. Also, when I was studying there, I learned a lot of international protocols that are followed in the clinic, which I am implementing here at Skin Aesthete. Throughout my journey in dermatology, even after passing out from London, I made sure that I have implemented those in my past clinic as well. So yeah, it's been a great journey, and you've been a great part of it. We both have done this together. We are partners in life, and now we are partners in business as well. How do you feel about it? Do you want to say something about it?
For me, Skin Aesthete, the journey starts very early where, you started off practicing with Dr. Udare, who has been a legend in this field. You opened up a new place for your own self, kept it running successfully for 8 years. And now together we have brought the machines here in Navi Mumbai, worked on how this place has to look like, the experience that the patient gets when he comes here for getting treatments. Every minute detail that you've taken care of is, very commendable and something which is one of a kind in Navi Mumbai. So I wanted to ask you a few questions. Sunscreen, ये दिन में 3 बार लगाना जरूरी है क्या?
Yes, and I'm sure you want to know why, right?
Exactly.
So, sunscreen application usually fades away within 80 to 90 minutes. That is 2 to 3 hours, right? So, it is advisable to apply sunscreen every 2 to 3 hours until the sun sets. Even if it's cold, it's dry, it's raining, it's summer, you have to use sunscreen, and it's mandatory.
What is this hyaluronic acid and the hype about it?
I am so glad. I mean, like, you pronounced it absolutely right.
And you asked me to get it from Korea last time when I was signing off.
Yeah, I mean, yes, that product was actually amazing. I have used it. And but having said that, there are a lot of treatments that actually boost your hyaluronic acid in multiple ways. For example, we have Exion in the clinic. There are skin boosters. And I want to give away one thing, that when you're using hyaluronic acid, you look for a combination of low molecular weight and high molecular weight hyaluronic acid combination that works best for your skin. Hyaluronic acid basically is a water collector. Like, it will just hydrate your skin well. So winters are coming. It's a good thing to go for any hyaluronic acid treatments or hyaluronic acid serums for that matter.
I've had a lot of acne when I was growing up. Is there something in my diet that could have helped that thing?
Yeah, of course. Do you used to eat like a lot of sugar or dairy products while growing up?
Yeah.
That explains it all. Like, because acne prone skin individuals usually tend to have a lot of sugar and dairy intake. But having said that, only those ingredients don't cause acne. There are a lot of reasons that cause acne as well. Cutting out sugar from your diet or cutting out dairy product from your diet does help in reduction of acne though.
I've not seen you do any, special routine or the hype 7 to 8 step routine, skincare routine that it's viral on Instagram. Is it actually necessary?
Right. I'm sure you must have seen that on Instagram, right? Instagram पे है काफी hype होता है, and what I feel is be minimal on your skin routine that you're doing at home. Like, use a very nice sunscreen because it will protect your skin from UV rays. Use a good moisturizer that is according to your skin type. Use pigmentation reduction creams or serums if you have melasma or if you have any pigmentation on the skin. You should be using retinol post 30-35, but not before that. And be very minimal on your skin routine. I mean, I don't believe in having a 8-9 step skincare routine, especially who has the time when you're working like 12 hours a day or 8 hours a day, who has the time to go and do a 8-step skin routine? It looks good only for Instagram and it is good only for aesthetics of Instagram. I don't think in real life anybody can do that on a daily basis.
So what was this double cleansing that you wanted to do when you came in last night?
So double cleansing is something that a person you should do who's applying a lot of makeup. Okay, so double cleansing is first using a good makeup remover, which is oil water based, micellar water or something. Use a good oil cleanser for cleansing the makeup first, and then using a face wash for washing your face. So that's double cleansing. Do you wash your face every night before you go to sleep?
Yes.
With what?
With just water?
With just water?
Yes.
Okay, you're going to start using a face wash now, for sure.
You have told me that you've taken up a lot of complicated cases in the past 1 year. Would you like to say something about it?
Complicated cases? Yeah, I mean, I come and tell you every day that I met this 19-year-old girl, I met this 20-year-old boy who's buying over the counter products. They're just ordering things from from online, and they're using such random products on their skin nowadays. So yes, I mean, this generation needs to understand that using so many products for skin is first of all not necessary. You can be very minimalistic on your skin routine and still have great skin. Every marketing company, every cosmeceutical company out there is doing great marketing for selling their products. I mean, they will write captions like acne-free skin. They will write captions like oil-free skin. They will write captions like, your way to acne-free life. And try this, you will get hair. Don't go for hair procedures. So these products are definitely marketed in a way that you really feel a lot of pleasure ordering them and then just stacking your cupboard up. And eventually, those people are coming to us for consultations and they're asking us, Doc, I've used so many products, I've invested in so many products. Why is it so that I'm not getting results? Because you will not. They are not proper medications which are supposed to take action on the pathophysiology that is happening beneath the skin. Skin is a science. There is a science to it. There is an understanding to it. It is medicine. So when a patient of fungal acne, a patient of acne is coming and sitting in front of me, there are different types of acne. How can a random one cream or a moisturizer work on all type of skin or all type of acne? It's practically impossible, right? So complicated cases in a way, I'm seeing a lot of people from this generation who are coming. They have destroyed skin barrier. They don't have great skin health. They don't know what product is suiting their skin. They're randomly using things. There are a lot of influencers who are trying a lot of products on their face, on their body, without taking advice from anyone, and they land up in situations where the product is not suiting them, where they're not happy with the product. And of course, then the doctor comes in the scene and the doctor is correcting their skin, and then, but if you ask me about my practice, I am very minimal on my prescription. I tell my patients that this is very simple. You don't have to do like a great skin routine. You can just use a great moisturizer when you're in 20s with a very good sunscreen. You can go ahead as you age, you can go ahead and use a little bit of retinol. But retinol also is like such a harmful drug. I would like to mention that. Retinol is such a harmful drug. I mean, it's a black box drug. It is teratogenic, means it has direct effect on the fetus. If a pregnant lady is even handling the strip of retinol, will have to go for an abortion, will have to do an abortion. So there are many individuals now who are coming and they are saying that they are applying retinol, which I feel is not safe. I mean, it is somewhere not great for your skin. It is disrupting your hormones as well. So you should consult a dermatologist before. And yes, the complicated cases are increasing. They are on a rise. Complicated in a way that they have destroyed skin barrier, which is very, very harmful. As they will grow up, they age faster. They will have photo damage, sun damage on their skin faster, and multiple things ahead.
What is skin barrier?
Skin barrier is a barrier of a layer on your skin which protects the skin from the outside world.
Okay.
Okay, so when you're applying a lot of acids, you're applying salicylic acid, glycolic acid, a lot of products come with mandelic acid, lactic acid, and even hyaluronic acid for that matter, vitamin C for that matter. If you have destroyed skin barrier, if you have redness, itchiness on the skin, no company will tell you this, that you should never apply vitamin C on a skin that does not have great skin barrier. They will just sell the product to you because they're making great revenue with it. But the truth is that if you don't have great skin barrier, and I emphasize on that because I'm a big advocate for it, if you don't have great skin barrier, you should not be using vitamin C, any acid. Vitamin C is eventually ascorbic acid, then it's retinol, or it's mandelic acid, salicylic acid. You should not be using any acids on your face. A simple moisturizer, retinol, yes, if your skin is healthy, takes you a long way with good skin health.
So, do you have any special message for the Gen Z?
Yeah, I have a lot of clients who are Gen Zs and they come with their moms, and especially girls. And I'm surprised, like even boys have come with their parents. 19, 20-year-olds who are using products, they're just buying it from Instagram, they're buying random brands, and every brand is marketing their products like they can reduce acne, you can be acne free, you can be oily skin free. First, please go visit a doctor. Understand what is your skin type. Try to get it evaluated first. Majorly, sometimes it so happens that acne patients में ऐसा होता है, we don't even give them any treatment. We just give them an anti-dandruff shampoo and their acne is completely settled out. Because it's fungal acne. So that has to be addressed. You need to see a dermatologist who's qualified. I want to come to that point. Who's qualified, who has a degree, who's board certified from a government aided body. And you should ask for a degree like when you visit a doctor, because there are a lot of people who are practicing dermatology just for the sake of it.
Yeah, even I've heard about this. Can you just...
So it's quack, basically. It's quackery. And there is a lot of quackery when it comes to dermatology. I don't know from where people have thought that dermatology as a field is super easy. I mean, I have had cases who have undergone laser with quacks. Like they've ended up having grievous injuries, like full face has become pigmented, and they've not even gone back to the doctor and fought with them, or even to ask them, what exactly did you do wrong? But I want to tell everyone that please go and ask the doctor for the degree or the qualification before you sign up for any skin concerns with the doctor. Because skin is something that you're wearing each day, every day. It has to be healthy, it has to look good. It brings out your personality, it brings out how you look. And even when you're feeling your best, you're looking your best, you're not having a great skin doctor by your side, I'm sure things are not going good for you. Every drug, every prescription, every small element that you put on your skin matters. And if it does not matter today, because it does not cause great side effect, it will eventually matter in the long run. Like if you're using retinol when you're 20, 21, which is not required, it will cause a barrier disruption, and that will give you bad results when you're 30, 35. you know so there are a lot of people who are practicing dermatology as quacks, and a lot of doctors are there in Navi Mumbai as well, and we have a good anti-quackery cell in Navi Mumbai, which we're trying as an association to get a ban on them. But it's a long way to go. But one person at a time, I try to educate my patients for it, because it is necessity of the hour that we need to do that.
Acha Sonal, one question. I went to that salon other day, and the people over there were suggesting कि sir आप hydra facial करा लो, बहुत अच्छा लगेगा. And the machine that we have in our clinic. Please tell me about.
Have you tried this hydrofacial that we have in our clinic?
Yes, I have.
Okay, and did you try the one that was there at the salon?
No.
No, you didn't. Okay, then you saved. So yes, hydrofacial as a word is been picked up by a lot of companies, and a lot of manufacturing has happened in India with that terminology. But the patented version of hydrofacial MD has been launched. It was launched in the US.
Okay.
And in this clinic we have launched it, so you know how different it is, right? Hydrofacial की जो machine होती है वो 22-25 हज़ार से लेके 22-25 लाख तक भी आती है. So you know which version we have. We have the version which is the best, and because the products of hydrofacial also come from the US, this is quite a patented technology. Which helps in great rejuvenation of the skin. For that matter, I want to tell you one story where a patient of ours had an allergic reaction to all acne medications. She was not able to take simple antibiotics like minocycline ho gaya, azithromycin ho gaya. Any antibiotic she was taking, she was getting a reaction. So what we did is, and we're going to publish it very soon, we did only hydrofacial for her. Because hydrofacial has glycolic acid, salicylic acid as glycol prep, the booster that we use in hydrofacial, her acne have reduced. I mean, her acne have gone down and she is doing much better. So it does help in acne prone patients. It does help in normal skin rejuvenation. It helps in giving you a very nice glow. It helps in reducing fine lines and wrinkles. There is a science in that hydrofacial which is called as a vortex technology. So what it does is when there's a probe that's kept on your skin, there is a infusion and there is also an extraction which is happening at the same time from that probe. So there's a lot of extraction of the pores basically that is done. Extraction of the pores means the pore cleansing happens. And there's a lot of infusion of good elements like vitamin C, arbutin, glycolic acid, salicylic acid, which help in further sebum correction, sebum control, जो oil secretion होता है उसको control करना, fine lines correct करना, wrinkles correct करना. So this all is a great deal when it comes to hydrofacial MD. And anyone, hands down, who does this treatment once will never go back to any other hydrofacial. I assure it.
Acha, I've noticed this on myself that whenever I've started eating a lot of eggs, I tend to have acne and, eruptions on my face.
Right. So diet plays a very important role in acne. Okay. Eggs में से सबसे ज़्यादा protein मिलता है. Right. A lot of gym trainers or people who go to gym, they take a lot of whey protein, if you've heard of it. Right. So they tend to get a lot of back acne, face acne, forehead acne for that matter. So eggs also work in the same way. They are protein, but your body is not able to process that protein very well. So you end up getting acne because of that. Having said that, you have to cross a certain limit of eating eggs, like beyond your daily requirement of protein. If you are eating eggs, then it will definitely cause you acne. But having said that, in some patients, you will see that they are eating like just 2 or 3 eggs. It is not suiting them. They're getting acne because their body is not able to process that protein very well. So eggs can give you acne. But if you are getting acne specifically because of eggs, you should not have eggs for that matter.
One of my friends was telling me that he sweats a lot. Is there a solution to it?
Sweating, the terminology that we use for sweating is hyperhidrosis. Okay, so when there is excessive sweating, it's called hyperhidrosis. So hyperhidrosis is usually not treatable with oral medications as such, but we do botulinum toxin, that is for Botox, for reducing excessive sweating. So in summers, usually we have a trend of patients coming in who usually have a lot of sweating on their arms and उनका shirt गीला हो जाएगा, उनको हमेशा उनका t-shirt गीला रहेगा. So they come in a lot in during summers to us, and we do a starch iodine test for them on their underarms or excessive sweating areas, and then we inject those areas with botulinum toxin. So that helps in reducing the sweating, but Botox does work for a certain period of time, and it is like 4 to 6 months, and then you have to repeat the treatment. But yes, for summer, you will be sorted if you do that treatment.
अच्छा, मैं as such कोई skincare routine नहीं करता.
Okay.
So what are the things that I should start with now?
Skincare routine karte nahi ho, you don't do anything. You don't use a sunscreen. You don't use a moisturizer. There is a very good face wash lying on the basin, but you don't use that face wash also. So start off with, wash your face with a good face wash. Then use a good moisturizer while going to sleep. Genetically, you're really blessed with great skin. And you don't look like you're aging also faster, but a sunscreen would do no harm. So you have to start using a good sunscreen.
But I think my skin is a bit oily. So I feel layered when I use that sunscreen.
So there are moisturizers for oily skin. There are moisturizers which control your oil production on the skin. There are procedures that help in controlling oil production on the skin. So you can regulate your glands accordingly. Once an oily skin will always be an oily skin, but there can be reduction in the oil production also, which will eventually help you. And also there are a lot of moisturizers, sunscreens which come in different formulations that help oily skin, acne prone skin, dry skin, normal to dry skin, sensitive skin. So you have to ask me which moisturizer should I be using, which sunscreen I would be using, not just random product which is on my dressing table, just pick that up and apply it.
Going back to that, how often should I wash my face? कितनी बार धोना सही है या गलत है?
So you should ideally wash your face when you wake up in the morning, but that's when you have the natural oils coming up out on your face. But twice a day is good enough. Twice a day is good enough. बार बार फेस वॉश करने से भी नेचुरल ऑयल्स जो हैं अपने स्किन के which maintain a good barrier to your skin gets destroyed, and that disruption is also not good for skin. So you can use a tissue. If you have very oily skin, you can just use a tissue for dabbing that oil off your skin sometimes. If you wear a lot of makeup, you should wash your skin, double cleanse your face, before sleeping at night. So twice a day is a good number that you should start off with.
I've heard that, drinking water helps in your skin and, your skin gets better with drinking water.
Yes, the overall organ health improves with drinking water. That helps in improvement of your skin texture. If there is less amount of, say, toxins in your organs, that shows better on your skin as well. So drinking water does not directly help with skin hydration, but it hydrates your organs. Indirectly, it does hydrate your skin as well. That's how it works. So,
Okay, so are expensive products better than the affordable products?
that's a very good question. There is a reason why expensive products are expensive and affordable products are affordable. Expensive products, especially like brands, okay, they put in a lot of R&D, they have a lot of research work that goes behind making a product, and then there is a brand value that adds to the cost of the product. Having said that, you always have to check the ingredients, the percentage of what ingredient exactly is there in the product for the product to actually work for you, for the problem you have on the skin. Like if you have severe pigmentation on the skin, Just a glycolic acid 1% serum or salicylic acid 1% serum is not going to help you. You will require a in-clinic treatment or say a higher amount percentage of glycolic acid to treat that, right? So affordable products are also great, which are available, but कुछ भी हो जाए without a prescription or without a dermatological recommendation, I don't advise that you should buy random products online and go for expensive products or affordable products. Some affordable products are so harmful for skin that you don't know what exactly is in there. So there are a lot of products that claim, कि this acts as equal as Botox does. There are a lot of Korean skin products. That's the hype that's happening in the market. And बोलते हैं कि Korean glass skin मिल जाएगी, Korean skin हो जाएगी. Indians can never have Korean glass skin. Our skin is beautifully colored. It is beautifully textured. Pores are real. Pores don't go away. People have to accept that. People have to work around it. People have to start understanding that Korean glass skin is for Korean people. It is just an Instagram marketing way or a brand marketing way that they say in बहुत सारा Korean product हम लगाते हैं, हम पे कुछ असर नहीं करता है, नहीं करेगा. Because you don't have Korean glass skin, Korean kind of skin at the first place. You have Indian skin type. Indian skin type is absolutely different. So it will not work on you. The hype of snail mucin that was recently there, even I called for it. I mean, like, it was such a hype. Even I called for a bottle. It is just lying down in my wardrobe now. I mean, I used it once and then I read about it. I got to know that it is not to be used on dry skin. It caused me a lot of dryness, a lot of irritation. My face was like looking red for days together. I had to treat it with a simple moisturizer which repaired my barrier later on. So, not necessary. An expensive product or an affordable product would help you. You should consult a doctor before you apply anything on your skin.
Collagen tablets, ये लेना चाहिए कि नहीं लेना चाहिए? Or is there a natural way of boosting your own collagen?
So, collagen tablets is a huge scam. Okay, because कोई भी tablet आप लेते हो, so there is a pharmacodynamics to it. Like when you take a tablet, it goes through your liver, it bypasses the liver, it goes to your intestine, it gets absorbed from there. So some percentage of that tablet is going and working on your skin. But in this clinic, we have a beautiful equipment called Exion, and there are hundreds of publications on Exion, which is stating that it boosts your collagen locally, by 47%. So I feel you can take those tablets because they give a feel-good factor that you're taking something. I think they act more like placebo than acting as collagen tablets per se. But sign up for something that will naturally boost your collagen than taking medications orally, So I had talked about this on one of the reels on my Instagram as well. And I got a lot of DMs asking about the same thing. So बहुत सारे brands हैं जो collagen बना रहे हैं and वो लोग बेच भी रहे हैं बहुत अच्छे से because उनकी marketing बहुत strong है. But I feel doesn't make any sense eating a collagen tablet.
Acha, going back to sunscreen, what are the misconceptions about sunscreen?
So there's one and there's a huge one that people think that when it is raining or when it is cloudy, when there are winters, you're not supposed to use sunscreen. But UVA, UVB, whatever rays are coming on the earth, you are getting affected by it, even if it is cloudy, rainy or sunny. So sunscreen is mandatory 24/7, 365 days.
I want to look like this forever. Is it possible?
Of course, you can look like this forever, but every person, every individual ages, right? So, like you were in your 20s, you don't look the same now. You look different. What is different? Your lines have come up. There are some laugh lines on your face, right? So, what happens is when you're aging, you're not only aging on your skin, but you're aging on skin, the subcutaneous layer, fat, muscle, and the bone as well. So you're aging in all these layers. So the solution to that is definitely going for some anti-aging procedures. jo usually people go for, like, and they do look like, you see many celebrities who look like they used to look in 20s also, and they now look the same. But there are a lot of botched up faces as well that you see कि आपको उसका face नहीं अच्छा लगता है अभी, like it looks like it has been done up, it is looking weird to you. So there are these jobs, like we call it dermal fillers and botulinum toxin, which are used in the market, and also a lot of plastic surgeries that are done for individuals to look the way they want to look. But having said that, if you ask me, in your face, I would not want to change. I like a man with who has a little bit of fine lines, has few wrinkles when he laughs, so it looks good on a man. So even when we're treating a male patient with anti-aging treatments, we make sure that the lines are not completely taken away. So it gives you a very feminine look, then giving you a very manly look. So we take care of that in case of men. For women, they do want a stretched look on the skin. They don't want any lines. They don't want any folds. So we do a treatment according to that for women. And so you will age eventually, but then it is to you to decide which kind of treatment you want to go for when. There are a lot of non-invasive ways of reducing your fine lines and wrinkles now. In our clinic also we have equipment like that, which helps in, reducing your fine lines, reducing your wrinkles overall. So there are a lot of things, techniques that are coming up. Electric muscle stimulation है, toxins है, fillers है, skin boosters है, बहुत सारी चीज़ें हैं जो market में आ रही है, which help in reduction of pro-aging, not anti-aging. They're pro-aging, they delay your aging.
How important is a good sleep for skincare?
It is very, very important because there's a lot of science behind good sleep and good skin. Okay, so there's a lot of cell regeneration that happens while you sleep because there is increased blood flow to your organs, to your skin as well. Your products are taken in well if you have a great sleep. And there's a very good hormone called as growth hormone, which is released in your body when you're sleeping, which helps also in rejuvenation of your skin. So yes, skin and sleep are related, but I understand, like, due to a lot of sedentary lifestyle people have, there's a lot of stress environment at work. People don't tend to complete their complete their sleep hours, So I always advise my patients to take care of their sleep. Dark circles, people who have dark circles due to lack of sleep, just get corrected with great sleep. They don't need any medications whatsoever. They are called as physiological dark circles. So they do get corrected with good sleep. So yes, they are connected. And if you have great sleep, you will have great skin as well.
Summing this up, can you just give one tip for good skin?
One tip for great skin is don't stop applying sunscreen. Sunscreen is mandatory 24/7, 365 days.
So thank you. It was really nice connecting in such a way because I've always admired her as a professional, as a mother, as a person. She always has had the empathy and compassion towards her work, the way she connects to her clients, to the patients, not only talking about skincare, not only talking about the problem with which the patient walks in, but the overall understanding of the patient and taking care of the root cause for getting the treatments and getting the best results out of this clinic is something which differentiates her from any other doctor in the world, I would say. And thank you again for letting me know about so many insights. I'll definitely try and include it into my daily routine.
You should.
And I'm sure the viewers will also appreciate the insights.
Thank you for doing this. I mean, I'm very happy that we sat together and did this podcast. To my viewers, I want to say it takes two to do the tango. So without him, I'm not there. Without me, he's not there. We are partners in life, now partners in this business, taking it an inch forward every day, and every day counts because you guys are supporting us with all the love and trust that you have within us for skincare. Stay tuned for more.